So good morning, everyone, and welcome to the first of the Family Caregivers of British Columbia's webinar series for caregivers. Today, we are very lucky to be able to be presenting with Dr. Nicole Domanski from the UBC Pharmacists Clinic and Carmen Leung, who's looks like a doctor of pharmacy candidate. Is that right, Carmen? Yeah. So they're going to be talking about services for patients and caregivers and common interactions between medications, supplements, and food. And we feel really lucky to have them with us. Just to give you a little brief history on us at Family Caregivers of BC, for more than 30 years, we've been working with caregivers, for caregivers, and to represent caregivers in the province. We take our primary mission of supporting caregivers very seriously, and we seek to work with you to help you individually, but also to help build community for you where you're living and working and caregiving, as well as to represent your interests and your concerns within the healthcare system and with government. So we're always looking for volunteers. If you're interested in volunteering for Family Caregivers of BC, please feel free to let me know in the chat and I may reach out to you. We're also always looking for more topics and more content. So if you have any ideas about webinars you'd like to watch, please also let me know in the chat. We do ask that with some housekeeping notes, you keep your video and your mics off, and feel free to put any questions in the chat box. I'll be managing the presentation for Nikki and for Carmen, but I will be keeping an eye on the chat as well. Okay, so with that, I'm just going to start sharing my screen. Is there anything you wanted to say before we got started, Nikki?
Not at all, just thank you for having us, and we're looking forward to this.
Fantastic. All right, let me just share my screen here. Fingers crossed it all goes smoothly.
Well, welcome everyone, and thank you so much for joining us today. I'm quite excited to be here today and to talk to you a little bit about the services that we offer for caregivers and patients at the UBC Pharmacists Clinic, and also speak on what sounds like a much requested topic, which is some common interactions between medication, supplements, and food. This is a huge topic and takes many semesters and many classes during pharmacy school to cover, probably almost the entire 4 years. We're learning about interactions between medications. But we hope to break this down and share some common ones that you might see with common medications or some of the things that you're picking up at the community pharmacy, as well as foods, beverages, and other supplements. So we will dive right into it. Please do use the chat function to participate and ask questions. We don't have too many slides, as I'm hoping to engage with you and answer questions that you might have. Next slide, please. Victoria shared some Zoom reminders for you. I think everyone has their videos off and their mics off, but like I said, use that chat box, please. Next slide. So just to start off, we would like to acknowledge that the Pharmacists Clinic, which is at the UBC Vancouver campus, is located on the traditional, ancestral, and unceded territory of the Musqueam people. And I am zooming in from my home in Vancouver, which is located on the traditional territory of the Musqueam, Squamish, and Tsleil-Waututh nations, where I live, work, and play. Next slide, please. So just a little bit about me. My name is Nikki. I use the pronouns she, her. I am one of the pharmacists at the UBC Pharmacists Clinic, and I'll share with you a little bit more about the structure of our team and what our clinic looks like in the coming slides. I am from the East Coast. Now, when I lived in Ontario, I thought the East Coast was actually Nova Scotia, PEI, but since moving to Vancouver, I realized that everyone here refers to Ontario as the East Coast. So I grew up and did all of my studies and training at the University of Waterloo before moving to Vancouver in 2019. And I joined the clinic that year. So I've been with the clinic for over 3 years now. And besides seeing patients, I'm also involved in student precepting. and some research. And my student Carmen is joining us today as well. Next slide, please. Carmen, do you want to introduce yourself?
Hi everyone, I'm Carmen. So I just finished my first year of pharmacy school at UBC, and I'll be working with Nikki this summer. Nice to meet everyone.
Next slide, please. Okay, so let's start off by talking a little bit about the pharmacist clinic and maybe how we are different from other areas where you might associate pharmacists working in. So at the clinic, we are based out of the School of Pharmacy. So we're integrated right into the faculty and the School of Pharmacy with all the students and professors and researchers. And we are a team of pharmacists that specialize in solving medication-related problems and concerns. So one misconception sometimes is that people can come to us to fill prescriptions, or that after a consultation, we are actually able to prescribe the recommendations that we are making. But that's not the case. When patients come to see us, and that can be done in person or on video or phone consultations, after we make our assessment and after we make a plan, we actually work together with the patient's other members of their healthcare team, and share our recommendations with their family doctor or with any other specialist so that they can prescribe and implement those changes. It's really important that patients have one consolidated prescriber. Otherwise, there can sometimes just be too many cooks in the kitchen and things get a little bit messy. So our role is really to support the patient, talk about medications, but then work with the other members to make sure the changes are implemented. We're looking at every medication and supplement on the patient's list to make sure not only is it effective, not only is it safe, but also that the patient is tolerating it and making sure that there are side effects. How can we help manage those side effects? Or if they're serious, do we need to look at some other medication options? So like I briefly mentioned, at the pharmacist clinic, we sort of have three main sort of pillars of care and service, and that is to provide medication consultation services to patients, to also provide learning opportunities for healthcare professionals and students. And our whole team is also involved in what we call practice-based research and evaluation. We don't do research and evaluation on our patients, but rather we're just looking at ways to optimize the practice of pharmacy and try to implement new and innovative services to improve the care to patients. And most importantly, a note I want to highlight is that the services we provide are at no cost to patients. So both the initial and follow-up consultations are free of charge. Next slide, please. So this is our team. It's an updated photo from this year, which I'm excited about. We have 5 pharmacists on our team. So when you come for that first appointment with maybe a patient or for yourself, if you're taking medications, the first pharmacist that you see is the pharmacist that you are going to be linked with for the rest of your care. You don't alternate between pharmacists, but you do have continuous follow-up with the same pharmacist. We have medical office assistants who will greet you at the front desk and help arrange your appointment and troubleshoot any video or phone issues. We have a research assistant to support all of those research and evaluation initiatives. Lots of students at the clinic, especially in the summertime. And we have a clinic manager, assistant director, and director. So that's the whole team there. Next slide, please. So I want to share some examples of the services that we can provide because it extends far beyond just a medication review. So obviously we are identifying and resolving those medication problems, but we also do a lot of education. So patients and caregivers come to us with different questions, things that they have read online or heard through friends, so we can use that one-on-one time to provide education. We have also vaccines in the clinic, so we can provide routine vaccinations as needed. All of our appointments are offered in person or via Zoom or phone appointments. We've also launched new group appointments. Group appointments are learnings for patients with the same medical condition in a small group setting. And this year we launched chronic pain and Parkinson's disease group appointments. There are appointments that run in the fall and in the winter, and they are in the spring and the fall, my apologies. And it's a series of 3 sessions. They run once a month. So you come together with your small group, and it's a lot of education and medication information that is divided over a 3 series appointment. And we also, like I mentioned, provide those detailed care plans to the healthcare providers and follow up as needed. Next slide, please. So this service, I consider it really for anyone. So many people can benefit from seeing that kind of clinical pharmacist and have time to walk through every one of their medications. But in general, if you're thinking about people in your family or your friends or even yourself who might be experiencing side effects from medications, maybe have been recently discharged from the hospital and some of medications have changed or even doses have changed, we can see those patients. If your kidney or liver function is changing, it's sometimes important to reassess medications because doses sometimes need to be adjusted as kidney or liver function changes. For anyone who is wanting to start or stop new medications, oftentimes it is advised to stop medications under supervision or assess starting new medications by talking to a pharmacist. If you're unsatisfied with medication outcomes, so lots of times people have been on therapy for years and they come to a point where they just don't know if it's working for them anymore. We also help patients with complicated medication regimens or problems taking their medications. So for example, I recently saw a patient who was actually taking medications and supplements at 8 different intervals during the day. And we were able to successfully consolidate that into only 3 administration times. What previously seemed like a daunting task in sort of governing her lifestyle now became such a easier thing for her to take and remember to take as well. Next slide, please. So you're probably thinking to yourself, how can I get in to see the pharmacist at the pharmacist clinic? It's actually quite easy. So we accept both referrals from the doctor or from patients themselves. You don't even need to wait to see a doctor to refer them to refer yourself to us. So although we do encourage doctors to send in referral forms, the reason this can be helpful is that sometimes that doctor can provide some extra history and information and notes for us to review before the appointment. That can be really, really helpful. So doctors can send in a referral form. It is available on our website, but a caregiver can refer themselves or their loved ones just by booking an appointment directly through our online link or calling our clinic. So Victoria, if you actually go to the next slide, this here is the landing page of our website. So if you just Google the Pharmacist Clinic, put it into your Google search bar, click on the first link, it'll take you to this homepage. And Victoria, if you just click again, and 2 more times. Perfect. So you'll see on the landing page, our phone number is there. Online appointment booking is an active link that will take you to our online booking page, or you can also submit a referral through that link. Thank you. Next slide. The other thing I really quickly wanted to mention is that over the last couple of years, more and more pharmacists, like my team at the Pharmacist Clinic, who do and specialize in medication reviews and working together with family doctors to optimize therapy, have been hired and launched all across the province of British Columbia through this program called the Primary Care Network Program, or PCN for short. So these are, again, pharmacists who are working one-on-one with patients, but now they're actually working directly in your doctor's office. So if you are attached to a family doctor, you can inquire whether that family doctor has a PCN pharmacist that is available for a medication review. Like I said, there are pharmacists working now all across the province on these interprofessional healthcare teams. You can go to this website for more information, and there is an FAQ section that is specific for patients, family members, and caregivers. So if your pharmacist is connected with your family doctor, we do encourage to attend and see that pharmacist. Again, mostly, like I said, they have access more to those records and are working directly in the office with the doctor. If there is no pharmacist available through the PCN program, then we are certainly available for help and care as needed. If there's any questions about this program, I'm happy to answer questions at the end. Thanks, Victoria. Next slide. Okay, so we'll dive into our requested topic of medication, supplement, and food interactions. So as if this gets complicated or there's questions as we go along, please do ask. Next slide. Okay, so first and foremost, I did try to add some polling questions to Zoom. It didn't work, so we are just going to pop the questions up and maybe get some participation in the chat. So Victoria, if you go to the next slide. So my first question for the group is true or false? When there is a drug interaction, side effects will occur or the drug might stop working. Is that true or false? And I would say these questions are a little bit black and white. There's not a clear answer as we go into this, but feel free to pop your questions in the chat if you'd like. All right, no one's taking a stab at this one. What about, we'll try the second one. I do encourage some participation. Natural health products are very safe and do not interact with medications.
Hi, Nikki. It looks like I'm having a bit of trouble with my chat feature here.
Okay.
I don't know why, but it's not working. However, I am getting some questions in the Q&A.
Okay.
So we did get one response to the first question that it was false, and we've had a couple of responses to the second question, also false.
Okay. Thank you for your participation. I was like, oh my goodness, are these questions too challenging? Well, they can be challenging because they are up for, there is, you know, lots to learn here, but I'm glad to see that we have some participation. Thank you, everyone. And it's good to know the chat is not working. I wonder why that's the case, but we'll work through the Q&A. So for those who did answer, when there's a drug interaction, side effects will occur, the drug will stop working. For those that answered false, that is correct. That's not always the case. So although it can be the case sometimes, it's certainly not always the case. And that goes for the second question as well. Natural health products are very safe and do not interact with medications. They certainly can interact with many medications as well as other supplements and natural health products. And although usually natural health products are considered safe, that's sometimes a misconception depending on those other medications that you might be taking and the other interactions that might be occurring. So lastly, sometimes a drug interaction can actually boost or increase the levels of a medication in the body. This can have positive or negative effects. True or false?
So far, I'm recording one false and one true for that.
Okay, we're a bit split. So this last one here, it is in fact true. Drug interactions can sometimes result in levels that are higher than normal. And Carmen is going to go into that in detail a little bit. So thank you everyone for your participation, and next slide.
Okay, so what is an interaction? So sometimes two medications that are safe to take by themselves are actually unsafe to take together. When certain medications are taken together, they can change the effect of one or both. This can cause mildly bothersome side effects, change how well a medication is working, or can even cause serious and sometimes dangerous reactions or other effects. This can happen not just with two medications are combined, but also when a medication is combined with a certain food product or a herbal product, like a supplement. And by herbal product, we really mean supplements, vitamins, or herbal remedies in this presentation. Next slide, please. So when people think of interactions, they often think of taking two different types of medication, such as prescription or over-the-counter medication, and having an issue. Although drug-drug interactions do happen and are common, they're not the only interactions. There are actually many different types of interactions. We'll go through the first three in details later. For example, there can be an interaction between the food you eat and the medication you're taking, causing a drug-food interaction. Taking a supplement with an active ingredient with a medication can also cause an issue, causing a drug-herb interaction. And by herb, we really mean supplements, vitamins, and minerals, and etc. Drug-disease interactions are situations where the medication used to treat a disease can cause worsening of another disease in a person. For example, some nasal congestion sprays can increase your blood pressure and thus should be avoided by people who have high blood pressure. Certain drugs may also cause allergies to get worse or develop new allergic reactions in a drug allergy interactions. For example, people with penicillin allergy should avoid penicillin antibiotics or some class or drugs of a medication that are similar to penicillin. Lastly, a drug and your genetics may affect a person's response to a drug treatment. For example, someone might be more sensitive to a medication because of their genetics. This is a drug-gene interaction. For example, a gene might make an enzyme that's involved in the metabolism of codeine, a medication for pain relief. There are different versions or variants of that gene that each have a different effect on how well codeine is changed in the body. Some variants will result in like a low functioning gene, while others might be hyperactive. How well a gene functions based on your genetics can sometimes determine how fast you experience pain relief. Next slide, please. It's important to highlight that there are a lot of different interactions. Many people are under the assumption that an interaction means that, oh, it's a side effect, or that an interaction means that the drug stopped working. But that is not always the case. Sometimes an interaction can decrease the effectiveness of a drug, making it not work properly. Sometimes an interaction can make the drug stronger than it's supposed to be. Lastly, it can cause unwanted side effects and pose an increased risk when taking long-term. Unwanted side effects can be experienced immediately, like nausea or an upset stomach, but side effects can also happen over a long period of time, like having like impaired kidney function. The change might not always be visible immediately. Therefore, it's important to periodically get assessed by your healthcare team to make sure that the medication is right for you or your loved one. We listed 3 possible effects listed in the presentation. However, these are not the only effects. Next slide, please. So to explain the possible effects of interactions, we have something called the therapeutic index. The therapeutic index is the amount of medication in your blood that is effective without unacceptable side effects or it being unsafe for a person. When a medication is in the green zone, the medication is effective and working properly. However, if a medication is in the red zone, it can cause unwanted side effects for which the drug can be unsafe. A drug may also be more effective in the red zone, but is actually unsafe to take. When in the blue zone, it means that the medication is not effective and not working properly. While the slide does say toxic in the red zone, the image is used as a visual aid, and toxic might not always mean danger, but rather it can increase the risk of side effects. When there's an interaction, whether it be medication, food, or supplement, it can cause the drug that's initially in the green zone, where it is working properly, to move towards the red or blue zone. And some medication have a very small or narrow green zone, and when an interaction occurs, it can easily jump towards the red or blue zone. Next slide, please.
Okay, before I dive into some common examples, I'm just going to address two of the questions that we had in the Q&A. So one participant asked if the clinic services apply to loved ones who reside in long-term care, and the answer is yes. I do see patients through Zoom and phone chats who reside in long-term care. Often the caregivers are present on the call, or sometimes if they have assistance with them as well, they will be on the call as well. But it certainly does apply to patients in long-term care homes. And we have another participant asking about collagen supplements' effects on antidepressant use. And I think this presentation will generate a lot of questions from the audience about very specific interactions. And I want to highlight, even as I go through these common examples, that when we look at two therapies, two agents that combined together can cause an interaction, there are also so many other external factors that we need to consider that might increase the risk of that interaction, or maybe there's an interaction, but that patient, because of external factors, we could say that's actually like a tolerable level of risk. It's a very, very low risk interaction. In general, when these questions do come in, we encourage that follow-up with a pharmacist so that we can look at it in the context of a patient. And like Carmen said, in the context of their medical conditions, allergies, intolerances, blood pressure, and so forth. To just address the question specifically about collagen and antidepressant use, I think collagen supplements are usually quite benign supplements in terms that, meaning that they, as far as I know, don't have a lot of significant interactions. So I don't see a glaring interaction with antidepressant use, but again, depending on the patient who is using it, I would like to see all the other medications and supplements that they're on before confirming, this is 100% safe and there's no concern with it. But Carmen did go through different examples of drug-drug interactions, drug-food, or sorry, kind of gave the disclosure that there's different types of interactions. So I wanted to dive in and give a few examples that you might have heard of or might be familiar with or know loved ones who are taking these medications. So for example, drug-drug interactions. Warfarin is a common blood thinner that is used, and many people who take warfarin or other types of blood thinners, such as maybe apixaban, also known as Eliquis, or rivaroxaban, known as Xarelto, who combine these blood thinners with anti-inflammatory medications, such as Advil, ibuprofen, or Aleve, which is naproxen, can certainly experience an increase in the risk of bleeds and bleeding. Like I said, that risk is different in every single person. There's lots of other factors that we need to consider to determine how high is that risk, or is that risk acceptable or tolerable. But for a general statement is that for anyone taking anti-inflammatory medications who is on blood thinners, including warfarin, other blood thinners, or even baby aspirin, which can thin your blood, should consult a pharmacist. Kind of that's the bottom line there. Another common drug-drug interaction that we can see is antidepressants and codeine-based pain medications like Tylenol 1 or Tylenol 3. So this does not apply to all antidepressants, hence the little star there, but there are certainly some antidepressants that when combined with codeine-based pain medications can end result in a decreased level of pain relief. So thinking about that therapeutic index, in this case, this drug combination is causing the pain medication to go down towards the blue zone, making it maybe less effective. Next slide, please. These types of interactions obviously occur with herbal products. Like Carmen said, that's kind of a general word that we're using in this presentation for any natural health supplements or natural health products or supplements. So ginkgo biloba can be, I often see questions around this or see patients on it. And again, when combined with blood thinners, can increase bleeding risk. I hope that this might be a important consideration, again, for anyone or any loved one on blood thinners, that there's actually a lot of interactions that can happen here that increase one's bleeding risk. It's a great idea to consult a pharmacist for a full medication review if you are taking any blood thinners and assess what that bleeding risk is like. And I just want to clarify again, the asterisks beside antidepressant. I did mention this, but just to reiterate, antidepressants, there's tons of antidepressants on the market and not all of them interact. So the asterisk there was just because there's a few in that category that can interact with codeine-based pain medications. The other one here is a supplement called St. John's wort. It can interact now more with antidepressants, no asterisks, antidepressants across the spectrum. And what it can do is it can boost the levels of a hormone we have in our brain called serotonin. And depending on the patient, depending on those other external factors, such as other medications that the patient is on, sometimes those levels of serotonin can get really far into the red zone. So St. John's wort is definitely one of those important supplements that I want to highlight to consult a pharmacist on before anyone starts it. Next slide, please. So interestingly, our medications interact with food as well. You can see here that grapefruit, interestingly, interacts with medications that we use for cholesterol, often termed statins. This includes things like atorvastatin, which is Lipitor, rosuvastatin, which is Crestor, and there's many other statins in that category. I'm just naming a few common ones. And this, in fact, can increase our statin levels and overall end up potentially causing side effects. Whether or not side effects are experienced is very interdependent, like there's many interpatient variability. So not everyone experiences this, but if you are a grapefruit lover, consult a pharmacist, because very interestingly, there are a few statins that don't actually have this interaction. So again, these rules do not apply to every patient. They do not apply to every medication, and sometimes they don't even apply to every medication in a certain class. But again, just as a sort of overall summary point here, if you love eating grapefruit or drinking fresh grapefruit juice and know someone or take statin medications, just touch base with the pharmacist to clarify if there is an interaction, and if there is, if you could maybe be switched to a different statin. Levodopa and protein is another important medication and food interaction. Levodopa is a medication that patients take who have Parkinson's disease, and when taken together with protein, it can decrease our levodopa levels, so moving it towards that blue level or that blue zone where it's not as effective. In this case, one way to mitigate this interaction is to space it by 1 hour before or after food. Again, these are things that a pharmacist can help explain and can help you decide how to manage these interactions. And lastly, levothyroxine, which is a medication for your thyroid or low thyroid function, can interact with things like coffee or fiber and decrease the levels and decrease the effectiveness of that thyroid medication. In this case, we recommend to space these type of food products with levodopa or with levothyroxine by 4 hours. Next slide, please.
Hi, Nikki. I just see there's a question here about levothyroxine. The question is, levothyroxine and coffee, fiber are mentioned. Is it the same for Synthroid?
Yeah, that's a great question, because I'm trying my best to refer to all these medications by both their generic name and their brand name. And Suzanne, you nailed it. Levothyroxine is Synthroid. So one in the same. Yes, it applies for Synthroid. That is the brand name.
Thanks. Okay, moving on to the next slide then.
Yeah, great question.
So natural health products are commonly known as supplements, vitamins, and minerals, and other herbal remedies. However, just because they contain natural ingredients doesn't always mean that they're safe. Natural health products contain active ingredients that are drugs with potential benefits, but also harm. Like all drugs, serious side effects and interactions can occur. It's also important to note that not all supplements you buy are made the same. Depending on the company or manufacturer, they have different qualities, different strains, or even different strengths. This means that how well they work or any side effects they cause may differ among brands or even within different bunch of the same brand. For example, certain conditions require a dosage that may differ from what the bottle might say. Magnesium is used for migraine prevention with a strength of 300 milligrams taken twice a day. However, the bottle might say, for example, take one tablet with a strength of 150 milligrams once a day. What the bottle say may not be indicated for the condition you're using it for. Another example is taking probiotics for IBS. There's actually specific strains of organisms that are used for IBS. Not all strains work for IBS. To summarize, not all natural health products are safe. If you're unsure about the safety or dosage, especially for like a specific condition of a natural health product, talk to a pharmacist. Next slide, please. To summarize, key point number one, sometimes two products such as two medications, food, or supplement should not be taken together at all. Sometimes two products can be taken on the same day, but spaced apart. There are actually many different types of interaction. Some may cause side effects, increase or decrease the effect of a drug, or increase risk from long-term use. Next slide, please. If you're unsure about over-the-counter medications, such as medication Nikki mentioned earlier, such as baby aspirin, pain medication like Advil, Aleve, Motrin, muscle relaxants, or Gravel, to name a few, natural health products, including but not limiting to supplements, vitamins, minerals, and herbal remedies, and prescription medication from the pharmacy, consult a pharmacist. They are medication experts that will help you and your loved ones to make sure that the medication you're taking is safe and effective. Next slide, please.
Yeah, so I just wanted to share, a few questions that I would encourage you to think about. And I get asked very often by loved ones, caregivers and their loved ones. So people are often thinking about side effects with new medications. They're always asking, what side effects can I anticipate with this new medication? And side effects can change as well over time. So side effects happen at the beginning of taking a new medication, but then over time, there can be a risk of developing long-term complications or side effects as well. So even though you have maybe been on a medication for a very, very long time and might not really think that you're experiencing side effects, it is good to reassess and reevaluate medications periodically. Obviously, we talked a lot about food and different food products. So whether medications can be taken with or without food is a great question to ask when you're picking up new prescriptions at the pharmacy. Sometimes we talked a lot about how food can decrease the effects of a particular medication, whereas other times it's actually important to take a medication with food. Without food in the stomach, that new medication can cause a lot of nausea and even vomiting or stomach upset. If you are an individual who is on many different herbal products, supplements, or is interested in starting new supplements, let your pharmacist know and ask about supplements that may interact with your medications. The other important question that I think that I really want to put out there is how to safely stop medications. Again, in the case of being on a medication long term and maybe wanting to come off of a medication, or you are experiencing side effects and you want to get off of it as soon as possible, depending on that medication, sometimes it's not safe to abruptly stop them, and sometimes it is. So working together one-on-one with a pharmacist to evaluate how to safely stop or decrease medications is also a great question to ask. Next slide. So we did provide a few very kind of patient and family-friendly resources about drug interactions here. So I do encourage sharing this slide deck and sharing these links and looking through these interactions. And usually the way the interaction is described and kind of what to do about the interaction is written very clearly, and it's easy to follow along. So we do like these links and recommend them. Next slide. Okay, so that concludes the presentation. As sort of my final key point and disclaimer is that information presented in a slide deck like this, it's not black and white. The rules do not apply all across the board. Every person is different, every condition is different, and the control of a disease can be different amongst patients too. All of these things make a difference on the way that pharmacists handle drug interactions. It is not a one size fits all. So although we do try to share examples and we do try to answer specific questions, we can't say things with certainty until we sit with a patient one-on-one, review the whole med list, review all their medical conditions, their history, and then we make final decisions together jointly. So that's my final important point that I want everyone to take home. And we have, I guess, over 15 minutes to take some questions. Oh, Victoria, you might be on mute.
I knew that. I was just testing everybody. So yeah, definitely slides will be made available. The recorded presentation, once approval has been received from various departments, ministry as well as UBC, will also be posted on our website under our webinar section. I would love to hear any questions you might have. Pop them into the Q&A, and any comments, pop them into the comments section. I would also like to just take a moment to thank you, Nikki, and you, Carmen, for taking the time to make this presentation. Honestly, even I learned so much today as a parent with a child who takes a number of medications. I also take a number of medications. I'm probably going to be connecting with your clinic just to get some of my own questions answered, especially around things like time of day and combining medications into fewer doses per day, and are there risks of medications interacting with each other if you're taking them at the same time, all that sort of stuff. So I learned a lot today, even around food. I had no idea about the grapefruit thing. Lots to learn.
Lots to learn, I agree. And we love educating patients. You know, I think that's part of patient knowledge, and education empowers patients to know more about their medications and what they're taking them for and how they should be taking them, and getting better, hopefully, outcomes as well. So I think we have a few comments coming into the chat right now. And let me just scroll back here. So the slides will be shared and the emails will be shared. We have some questions about supplements for leg and food cramps. And again, with my disclosure, this is such a great question. And I don't think that there is like one general supplement that I can recommend with confidence. Part of the education that we do around supplements and natural health products is actually looking at the evidence behind them. So what kind of research has been done to study a natural health product, in a group of people with a certain medical condition, such as like in foot cramps, and to see, like, are you getting a lot of benefit from it compared to just taking a placebo pill? So when we make these recommendations for supplements, we usually review the evidence and try to give ones with really solid, really good evidence that we know can work. Unfortunately, in certain medical conditions, we just don't have that evidence. So although many supplements can be safe to try, they might not necessarily be effective. And when the efficacy is not there, then our recommendation is not that strong. So that's kind of my roundabout way of saying that there isn't necessarily a supplement that I strongly recommend for leg and foot cramps, but there are some things to do beyond medications that if we met one-on-one, we could talk about symptoms, we could assess your other medications, and we could look at some other sort of lifestyle factors that might improve those kind of symptoms. Okay, so is there a preferred way to stop long-term baby aspirin? Also, what is the minimum dosage of baby aspirin to be effective on a daily basis? Whenever I have questions about baby aspirin, I see like a little red flag going off in my head because I would need to talk one-on-one with patients to really determine what is the reason that they are taking baby aspirin for. I would say in the last 5 to 10 years, we've had so much new information out about baby aspirin. Once I believe baby aspirin was sort of recommended across the board for everyone. And now baby aspirin is really only recommended for select patients. So without going into too much detail, typically a dose of baby aspirin that might be recommended for select patients is 81 milligrams. It is the kind of low dose baby aspirin that is available over the counter, but not everyone should be taking baby aspirin. And if you're not taking baby aspirin for the right reasons, you could be very well inadvertently increasing your risk of bleeding. So I would say, please talk to your pharmacist about baby aspirin. Please talk about stopping baby aspirin if it's right for you to stop. But if you're one of those people that might really need baby aspirin long-term, then I don't want to make a general statement to say that it is safe to stop. But usually 81 milligrams is the typical dose that we recommend for the low dose. Oh, question from the Q&A, consulting with your group, such as the Pharmacists Clinic, make a GP feel like their prescriptions are being questioned? That's a fantastic question. Thank you to the participant who addressed that. And I think that is certainly like maybe a misconception that can happen, but the way that we work with family doctors, we really do it in a fashion that is supportive of their care and their prescriptions and the relationship that they have with the patients. So, granted, many of you might have experienced when you go into a doctor's office, you might just not have all the time that you want to ask all of those questions. Sometimes that time can be limited. So it's great to be able to follow up with a pharmacist who, I'm not sure if I mentioned, but our intake appointments are actually 1 hour long. We gather a lot of information and we have sort of that luxury of time to be able to answer all of your questions and to follow up with you. If we do make a recommendation, we want to see what that outcome is like. And when we send our notes or documents to the family doctor, we use language in a way that is, very, very collaborative. And we want to just showcase that we are here to, support them and support you. And usually, the decisions that we make together are very much shared decisions. So we're presenting options to the doctor, and we encourage you to follow up with your family doctor and say, they've received my note, and now it's up to you to have a discussion with your family doctor about what options you want to pursue. That was a great question. I'm not sure if this recording will be posted to the Pharmacists Clinic website. There's tons of information already on our website. I think it will be circulated amongst the participants, and Victoria, I think you'll want to post it to the Family Caregivers of BC, right?
Absolutely. Great. It'll be in our watch section in the Learning Center on the website.
Yeah. And I'm seeing some questions come in from Ben. Ben, you shared that you have Parkinson's and you have some questions about dose size is high. What is the risk for adding these to Parkinson's? Ben, fantastic question. However, you know, that's an example of maybe questions that we would want to get some more information about your medical background, all of your medications. So let's sit down one-on-one and kind of address those more in like an appointment with you. So any patients who have memory problems or dementia, we can certainly review medications and come up with some ways to make it easier to administer meds. This is also a great question to bring up with your community pharmacy about blister packs. Community pharmacies can offer blister packing, and that can be such a game changer for many patients. Now, if blister packs are not an option, sometimes patients have, you know, really difficulty getting the meds out of there, then we can brainstorm lots of other ways to facilitate easier medication administration. Yes, we do Zoom appointments, so you can meet with our pharmacy team one-on-one via Zoom. I have lots of patients who do live on the island, so everyone is welcome.
It's amazing how much the world has opened up. I mean, I know COVID has been very catastrophic, but I do feel that there are areas where we've actually been able to expand and grow service because of it. So
yeah, I totally agree.
okay, does anyone have anything else they'd like to ask? Any other things that have been sort of bugging you or that you're curious about? How do you make an appointment?
Yeah, so that's, yeah, that's yeah, everybody wants to make, yes. I'm glad these questions are coming through. And the best way to make an appointment is, again, calling our clinic. We are open from 8:30 to 4:30 Monday to Friday. You'll reach our front desk staff and they can book you in, or you can go on the online, we use a platform called VeryBook right now. So it's an online platform where you can schedule appointments with the pharmacist team. On the online app, I think there'll be a number of pharmacists that are available for consultation. So if you won't see me, you'll see one of my very amazing and knowledgeable colleagues.
Question about MSP.
Yeah, so these are provided at no cost to patients, the service.
That's amazing.
Yeah.
Okay. I agree with everyone who has been saying thank you. This was very informative. I really do appreciate you both taking this time for us and for our caregivers. Again, I'm going to just reiterate that the slides are going to be made available. Contact information and how to schedule an appointment is on one of the slides. If you find you're confused or don't know the next steps after looking at the slides, don't hesitate to reach out to me and I'll share the phone number with you for the clinic for sure.
That's great. Well, thank you everyone for your participation and questions. And you know what, since many people are just asking for the phone number as well as the link, I'm just going to pop it in the chat so everyone has it. So
thanks, Nikki.
That's okay.
Seems to be a very important question right now. Yes. I think everyone's like, oh, now I want to know.
In the chat there, our link, or call the clinic.
Do you ever get patients coming to you because they've got someone who struggles with taking medication in the form that it's been dispensed? For example, I've got my daughter, she struggles with pills, but some of the medications she takes, in order to make it a pill small enough, she'd be taking handfuls of them. So is that something that comes up for you?
Yeah, great question, Victoria. It certainly is. And some medications can be crushed, some cannot be crushed, some capsules can be opened, some cannot be opened. Sometimes, like, you know, one medication in a certain class cannot be available in a liquid form, but just switching to a different option might allow liquid options. So yeah, certainly a question that we do address.
Okay, I'll be contacting you later then.
Okay, well, thanks everyone for your time. We are on time today, I think. So
Yeah.
enjoy your morning and afternoon and stay cool in the hot weather.
This is our Family Caregivers of British Columbia website. To find the Learning Center, you'll see it under Resources and Education. Go down to Caregiver Learning Center and click. Once you're there, you'll see we have 4 sections: read, watch, listen, and take a class. Under read are all of the written articles that we have, blog entries, that sort of thing, in all of these different categories. Under watch, you'll find Facebook Lives, webinars, and other video recordings under the same categories. And under listen, you can access our full selection of Caregivers Out Loud podcasts. I encourage you to take advantage of our caregiver resources under the Resources and Education tab. Thank you so much for participating.